Welcome, I'm Jon Caldara, president of the Independence Institute and your devil's advocate. A little later in the program, black and conservative, can it be? We'll find out. But first, Medicare expansion in Colorado. You heard the governor. We want more Medicare. We want more Medicaid. We want to expand Medicaid. And that's a great thing because we don't have to pay for it. The feds do. To talk about it from the Independence Institute, Linda Gorman, thank you for joining us.
Oh, thanks for having me.
First, a quick explanation. Medicaid compared to Medicare. Medicare is for older folks. Medicaid is for people who don't have enough money to pay for their own health care. Do I have that right?
No.
Medicaid is for people who don't have...
Originally it was,
Really?
but right now it covers far more than the total number of poor people in Colorado. It's moved into the middle class. Under the expansion, they want to cover any single adult who's making more than about $15,500, which is entry wage in some places.
Towards what level? I mean, how much money do you have to make until you can't get Medicaid?
Over $15,500, you wouldn't get Medicaid if you're a single adult. But remember, that doesn't count any housing assistance you get, any food stamps, any energy assistance. So you have to get over the notion that Medicaid is just for the poor people. It originally started out that way for people who can't help themselves and who need help. But it's been expanded so much now that sometimes the people who really need the help are in danger of not getting it.
So when I hear this term Medicaid expansion, and Hickenlooper says we want Medicaid expansion, that means we're going to cover more people in Colorado with Medicaid, right?
Yes, it does. They're saying 160,000 is their estimate.
Well, isn't that a good thing? Why would anybody not want that? These are people, even if they make enough money or they can get health care someplace else, this is a good thing because the money's coming from the feds, right?
That's what they say, yes. 3 reasons why it may not be a good thing. 1, their cost estimates look like they're pretty screwy.
That's never
2,
happened before in government.
Never happened.
They've never lowballed something like this.
We should just believe their cost estimate. Second reason is that Medicaid in many ways does not provide particularly good medical care, especially if you have, special needs and things. You have to wait a long time. It's hard to get specialty care, and you have a restricted number of providers and sometimes a restricted number of drugs. So if you have the choice between Medicaid and a commercial insurance plan, for a lot of people, they might pick the commercial insurance plan, except you can't do that if the state expands Medicaid. You must be on Medicaid. You can't go to the Obamacare subsidized plans. You have to be in Medicaid.
Well, hey, this is new information for me. So if we expand the roles of people who are eligible for Medicaid in Colorado, if we didn't do that, some of those people who weren't eligible for Medicaid would be eligible for Obamacare.
Yes.
Which is much more coverage than Medicaid.
Well, it's actually not more coverage on paper because Medicaid has like $5 deductibles if they're collected, or copays, right, which they're never collected because it costs too much to collect them. And it covers everything from over-the-counter medicines to ambulance transportation or taxi rides. But the problem is that they pay so little under Medicaid that a lot of providers won't participate. So it may be very inconvenient for someone to see a doctor under Medicaid. And if you're making enough money, you may say, I'd rather have a plan that suits me better.
A private insurance plan,
yes,
that I can get through the Obamacare.
Or I can have a savings account,
right,
with it and so forth. But this doesn't give people any choice, and Obamacare doesn't give people any choice. So before we rush into this, we really should look at how the patient population they're talking about is going to be affected. And I haven't seen any analysis come out of the state looking at that. I'm hopeful.
You're hopeful. Keep on hoping. What does it cost? Why would I care?
That's a good question.
Why would I care if the feds are going to pour more money through Colorado's government to expand Medicaid? That's a wash. We get more stuff from the feds. We have 50 states, they're all fighting for it. Let's get our share before somebody else gets it, and we're able to do these good things with it.
Well, a lot of the money is going to go to government entities because those are the hospitals that provide Medicaid and nonprofit type federally qualified healthcare centers and so forth, because Colorado has been in the process of setting up its own separate medical empire for Medicaid patients. They don't usually, or many of them don't go to the same physicians and hospitals that the general population goes to. As far as how much it costs, nobody really knows. The thing that I'm using as a marker right now is Wyoming. They had an independent actuarial firm Milliman come in and do the estimate for their Medicaid expansion. And Milliman has a top-flight reputation, and they tend not to mess around with their numbers. They give you actuarial speak for their best bet. And they're saying, and I actually wrote it down, that for their 28,000 people that they expect will come in under their Medicaid expansion, it's $62 million. And if you took the Colorado caseload, which is about almost 6 times larger than the Wyoming one, that the governor is estimating, and you apply the same factor to it, you come up with about $450 million over the next 7 years. So that's a lot bigger than what the state is saying. And the Kaiser Family Foundation and the Urban Institute are estimating in excess of $800 million. So there's a huge variation in these estimates, and the state of Colorado is way on the low side. So until we see how they arrive at these estimates, it makes no sense to believe them. I mean, they're trying.
But in a way that even I could understand. So if we have 100 and how many thousand new people in Medicaid?
They're saying that there will be 160,000. Now that's their estimate. Who knows how they got there? Yeah.
All right. So let's say 160,000 people in Colorado now join the Medicaid rolls, and if it goes higher than what they expect the cost to be, still isn't this federal money that's going to come in to cover that cost?
Well, not all of it, because the state still has to pay administrative fees that are about 4% of the total cost. So as the caseload goes up, those administrative fees go up. The second thing is that the 2013 Obama budget already reneged on some of the federal money. There's nothing that says the federal government going forward has to do what it said it would do. The other thing to keep in mind.
Wait. I'm thinking what usually happens. So we get 160,000 people now in the rolls of Medicaid. Mm-hmm. It costs more, and there's no guarantee that the feds are actually going to pay for it. We still have to do the administrative costs. But if that guarantee doesn't happen, and that's happened in the past, mm-hmm. what do we do? So in other words, Colorado is going to be on the hook for this extra money, and that's a tax increase.
That's a big problem, because Colorado right now has a structural fiscal imbalance. Even in DU, the Independence Institute and the people at DU are in total agreement that by 2025, education and Medicaid spending will eat up all the tax revenues there are, and there won't be any money for anything else. So something has got to be done here, and obviously what you don't do is increase the size of Medicaid, because costs are going to increase anyway under Obamacare. There are going to be a lot more people in the program. Caseloads are going to increase for a variety of reasons. And so we need even if we do nothing, Medicaid spending is going to increase in excess of the increase just from healthcare cost increases. So it makes sense to sit and look at this budget problem and see what we're going to do. Now, of course, DU and Independence Institute part company, because DU says, well, we just have to raise taxes. But actually, Colorado doesn't have a lot of room to raise taxes if you look at the fiscal situation.
Why not?
For starters, real personal income has been falling. The number of people in the private sector labor force has leveled out, hasn't changed in 10 years. And the states around it are cutting their taxes. So if you just go blindly forth and raise taxes in Colorado, mobile people will leave, and your tax revenues may not respond or could fall. So you have to think about raising taxes too. There's no simple solution here.
All right, well, let me ask you to stop being a heartless woman here for a second. Imagine you actually cared for people, and you're saying, well, there are people out there who need medical services. There are people out there who can't afford all their medical services. Mm-hmm. Obamacare, whether you and I hate it, is still now the law of the land, and we're going to have to work with it or mm-hmm. work around it. What do we do for these 160,000 people who we're told need more help?
Well, we're actually not told that. We're just told that they would sign up for Medicaid. They do get help now through the Colorado Indigent Care Program. And one of the things I think the state should look at before they go for a Medicaid expansion is whether it's gives people better care and costs the state less money if they help them through Colorado Indigent Care Program. This is a blend of subsidized care and individuals have to pay. So there's more cost control going on in here for all parties involved, and it's far more flexible.
Because it's also controlled at the state level,
yes.
not at the federal level.
Yes.
So we can tweak it, we can change it. The legislature can see what's working, what isn't, and since it's closer, it can be more accountable.
Yes, and these 160,000 people are probably getting health care somewhere now as it is if they need it. So the question is, give us more specifics on where they're getting it and how much it's costing. It may be that it costs less to, for example, pay for their acute care needs than to just sign them up on Medicaid, which is basically the state has to cough up so much per year whether people use health care or not. It's likely that the uninsured people are relatively healthy, in part because you can enter Medicaid through disability regardless, of whether you're in the covered zone right now. And also,
in other words, my son who has Down syndrome, we had to wait 5 years on some wait list, and now he's Medicaid eligible for certain things, not for everything. And I still don't know how to use it. We haven't pulled a dime out of it. So,
but he is, and through disability, not So people who are really ill and disabled are probably from that income group on Medicaid already. So you may have people who just need routine health care. Well, it's probably less expensive to just let them go to federally qualified health clinics or maybe, help the really acute care cases through the Colorado Indigent Care Program. I don't know. The thing that bothers me is I haven't seen the state looking at this. This state hasn't hired Milliman to come in and look. We just get really sort of lame press releases from the governor's office that tell us, how great it's going to be, and also that they're going to cut Medicaid spending by $280 million, which leads me to ask, why hasn't this been done before if it's so obvious?
All right, let me kick this back and see if I'm understanding it. It's fine for the government to say, here's a great program, we think it's going to cost this much. If things like RTD's Fast Tracks teaches us anything, is governments will say what they need to say in order to make the numbers work to get it passed either through the legislature or at the ballot box. But as we now know, it's costing twice as much as promised. It's not being delivered the way it was promised. It's Colorado's big dig. I think will go down in history as Colorado's biggest sham. In the same way, we're not talking about choo-choo trains or whatever the equivalent is. We're talking about human beings, and we're building a program up that we haven't looked at, and we haven't had a third party come in and say, here's what likely could happen.
That's right. And right now, it was really interesting in the last year's state financial report, the controller issued a warning in controller language, which was like, pop your eyes out. He basically said, look, 38% of the state's budget is coming from the federal government. It's spending way more than it takes in taxes. Given the shape that the federal government is in, you might want to reconsider having that much of your budget come from them. I mean, this is something you never see in financial reports. So clearly there's some concern, and there ought to be concern on the part of citizens.
In other words, when we can no longer write a blank check or go into debt on the national level, Colorado, a third of its budget could evaporate.
Yes.
Well, thank you for cheering us up on that. I appreciate it. So in other words, Governor, hold off until we know a little bit more. Linda Gorman, thank you so much for being with us. Stay tuned.